Say no. The ayes have it. Members, that takes us to motions on notice. The Honourable Ben Dawkins.
Thank you, President. I have a motion on notice, as you know. So I move that the Legislative Council acknowledge that some West Australians were adversely affected by some state government COVID-19 policies.
Members, the Honourable Ben Dawkins has moved that motion and the question is the motion be agreed. The Honourable Ben Dawkins.
Thank you, President. This is not a controversial motion in any way, regardless of whether you agree with what I also say in the next few minutes. It's certainly not controversial. The Honourable Roger Cook did say, and I think this was just in August, a couple of months ago, of course we acknowledge that some of these decisions impacted on individuals negatively. Really, and the way that this motion is framed is almost, you might say, a statement of fact. I know that the Honourable Roger Cook did say that, however, the policies that were introduced by the McGowan government during COVID were required to protect the wider community. And this is where we run into big problems with individual freedoms, individual rights and freedoms, and things such as bodily autonomy. So I would say individual rights and freedoms, such as bodily autonomy, are sacred. And the importance of preserving them should override the whim of the government of the day. When I say whim, I mean there is enough evidence in the words that have been said over that period to suggest that the vaccine mandates, for example, were, to a degree, we can argue about how far or how big that degree was, large, were a degree related to political popularity. So getting back to this tension between individual rights and freedoms and government influence, maybe that's something that's obvious to me and has become obvious to me more as my time here and speaking to individuals in the community has progressed. But maybe, and I don't necessarily wish to agitate this issue again, but maybe if you're a Fabian socialist, you don't actually understand the importance of individual freedoms. So maybe there is something there in the article by Paul Murray, even though, which I referred to previously in the House, even though he didn't talk about, he actually didn't talk about COVID in that one there. So what happened during COVID is that the government said that vaccines were safe and effective and demonised anyone who questioned this. Anti-vaxxers, cookers and science deniers were not to be tolerated in our society. These people dared to question how it could be known that vaccines were completely safe and effective if they had only just been developed. These people were aware of the usual practices of long-term clinical trials before a medication can be declared safe. These people pointed out that the vaccine manufacturers had been given legal immunity from individual claims and the federal government assuming liability for side effects, and that this indicated that the manufacturers knew that the vaccines were not completely safe. These were reasonable points to make, but the viciousness with which people were attacked for pointing out the obvious was very disappointing to see. It turns out, as we know now, and this is not controversial, the vaccines were not completely safe. Of course they weren't. Many people who got the vaccine died of COVID, so they weren't necessarily effective either, maybe to the degree that they were said they would be. Surely mandating a medical intervention in a one-size-fits-all approach is not acceptable if you are not very sure of the outcome. It is also another medical principle to do no harm. We were told vaccines would stop the spread. We now know that they did not stop the spread at all. Almost everyone got the virus, and Pfizer, for instance, never investigated if their vaccines would stop transmission. Maybe better scientific phrasing would have been that the vaccines could hypothetically limit the spread to less than it would have been without the vaccine. although we have no baseline to compare it to. But it's hard to get that onto a poster for a 15-second advert. But the government chose to mandate vaccines based in part on the rationale that it would stop the spread. So when I say some people harmed by the vaccine, President, I do know that there has been a report done into the WA government's COVID response, and this is a report here. And I would say here that even this report does touch on adverse events from the vaccine. And it says here, this is actually page 77, a review of Western Australia's COVID-19 management and response, July 2023. Rarer side effects were observed after AstraZeneca was administered to Australians, including severe allergic reaction, blood clots, myocarditis and pericarditis, and that's from the department, quoted from the Department of Health and Aged Care. While small in number, these rare side effects contributed to some anxiety surrounding vaccine. Well, hello, of course you're going to be anxious. And what should have happened is, and this is where I intend to spend some of my time today, is looking at the mandates and the employment outcomes. I have a background as an employment lawyer, and it's the side effects or the adverse events and the mandates which I take, which I have particular interest in, and how that affected my constituents. As soon as this stuff became known, the mandates should have been dropped, the vaccine mandates, because we know we're doing harm. We know it's causing, I don't really care how infrequent the government says these things were. Once you're mandating something that's unsafe to any degree, doesn't that become rather evil? I would also say that in terms of, you know, the lack of controversy in this motion, the Australian government also talks about, on the Australian, the Department of Health and Aged Care website, it also talks about COVID-19 vaccines and cardiac inflammation, particularly reported in males under 14 years of age. So, and it does draw a link between, or it actually says there is a link between COVID-19 vaccines and rare side effects of myocarditis and pericarditis. So, actually, I seek leave to table this website, President.
Is leave granted? Leave is granted. That document is tabled.
So, getting back to the government's existing report from July, I do note something here at page, it's actually recommendation 29, which says the WA government should advocate for an expansion of the existing Australian government COVID-19 no-fault vaccination injury compensation scheme. All right, so we're talking about compensating people for injuries from the vaccine. That is actually a report here. So probably not, I won't get an answer today because the Health Minister's not here, but I would like to know, President, how, for my constituents, the government is lobbying the federal government to have this compensation scheme for vaccine injuries expanded. So that'll probably be a question I can put forward later. This is the reduction. This is actually the website that refers to the government's COVID claims scheme. I seek leave to table this to the House, President.
Is leave granted? Is leave granted? Leave is granted. That document's tabled.
So these things were also acknowledged in the vaccine safety report. I know we're waiting for the next one, Honourable Peter Collier and Honourable Nick Duran, but for some reason the 2023 one has not arrived as yet. So we are waiting for that one. But even if you look at the 2021 vaccine safety surveillance system, quite a few S's, annual report, you will see that there were 10,000 vaccine injuries in there in 2021, I think it was, as compared to the previous year. So this is not controversial that we have an issue here to deal with in our community. The pericarditis I've spoken about before is suffered by my nephew, and his doctors have linked that directly to the vaccine. So let's just stop this culture of fear or this culture of demonising anyone who wants to talk about the safety of the vaccine and, by extension, the mandates. We're told that these cases that I've referred to of damage are rare and that most people recover quickly and only have mild symptoms. Based on that statement, it would be reasonable to assume that some people do not recover quickly and their symptoms are not mild. Indeed, some symptoms recorded were death. So I've put out the call on various channels asking people to contact my office if they wanted to share their COVID vaccine injury story with me and also job losses associated with the mandates. The most common complaints from West Australians who've contacted me over the last few days were heart complaints. They used to be fit and active, but the COVID vaccine, their heart tissues and their doctors advised them not to do too much exercise, which is what my nephew has been advised as well, as a fit 35-year-old man, father of 4, but prior to receiving the vaccine, which was mandated, and he was coerced to take effectively in order to continue with his job in the mining sector. Also common were reports of ongoing immune disease following the vaccination, including ongoing injection site pain, brain fog, general action pains. And people say their doctors are having trouble diagnosing what is affecting them, but they are sure it was because of the vaccine because their symptoms started shortly after it. Another very common report is some people genuinely feared the vaccine for a range of understandable personal individual reasons, and being forced to take it caused potentially mental health harm for them. I'm going to just read an email here, President, and this is from Julie, who's contacted me just in the last few days. So this is getting us onto the issue of the way that the state government dealt with its essential workforce, particularly police and nurses. So Julie writes to me, she was a hospital-based healthcare worker for 23 years, studied at university for 5 years as the basis of her healthcare career. Julie's not a real name, by the way. For the last 17 years of her career, she worked at Royal Perth Hospital before moving with the department to Fiona Stanley Hospital. When the COVID vaccine mandates arrived, I refused the vaccines for 2 reasons. Firstly, I was reading evidence that COVID vaccines available could be harmful for me given my own health history. So we need to appreciate people have individual health history, which may have made it unsuitable for them to get the vaccine. The early evidence was showing that they did not stop you catching or transmitting COVID, and they were not safe. This has become more strongly indicated over time. I kept waiting for the vaccines to be withdrawn from the Australian market, given the growing evidence of adverse events, but this did not happen. The second reason that Julie refused the vaccine was that mandating a medical procedure was completely against medical ethics. This is in terms of what this nurse has said, and she has 23 years' experience in the health sector. That's her take on this. So now that the mandates have been lifted, however, for 17 years, Julie worked in a very specialised role, and the position has been given to someone else. It is quite difficult for me to return to the healthcare system because the positions available in my area of expertise are so limited. I spent many months in 2022 and 2023 cleaning houses, but now I have a casual job driving trucks on the mines. Oh, that's good. There are so many stories like mine, and I could go on. So what I would say about the public sector, management of the public sector workforce, nurses and doctors in particular, is that it was totally mismanaged. Irrespective of any public health directive, that does not override the non-delegable duty that an employer has to an employee. So we've had, I think there were 47 police officers and several thousand nurses who did not want to take the vaccine. As we know, they've been sacked or in ongoing legal battles with their employers. I do know that the action by a group of police officers, led by one very brave and commendable young man, experienced police officer of 15 years, I do know that that particular group, President, has spent $800,000 fighting to keep their jobs or obtain compensation, you might say, for having been sacked or disciplined over the vaccine mandate. That is an absolute disgrace for all of us and our legal system, that because people want to maintain their existing rights and freedoms, they have to spend that amount of money to get any recognition from the government. It is also a disgrace from the previous Premier of this state, the previous Health Minister of this state and the Police Commissioner, that they treated their employees in this way. The idea of terminating experienced, trained and valued critical workers for choosing bodily autonomy over mandatory vaccination is evil and completely dumb and commercially irresponsible. Given our workforce issue with these people at the time, Honourable Peter Collier, particularly in the police force, for example, and with nurses, now, yes, we're struggling for numbers, yet we treated these important workers with such contempt at the time. So many are lost from our profession forever. So our courts and employment industrial tribunals laws are totally insufficient to deal with this circumstance. So what I would say about this is stand down. So the principle of standing down people if they cannot be usefully deployed in the workplace through no fault of their own. So that is a principle that exists in our employment laws. That's what should have been applied here. You should be allowed to stay home, paid or unpaid, if you're refusing a vaccine, because it is not the individual's fault. And we're getting back to fault. Stand down applies where there's no fault of your own. It is not the individual's fault that they choose to maintain their personal freedoms, not to have medical treatment forced upon them. So why, in God's name, are we sacking people in that circumstance? It is just insane. It is not their fault. They should be redeployed at home. Whether they're paid or unpaid, or whether they're working or not working, it doesn't really matter. But that is actually what JobKeeper, and I know JobKeeper doesn't apply in the public service, but that is the whole idea of JobKeeper. If some unforeseen event, like a pandemic, comes along, whatever the public health officers say, chief health officers say, they can say what they want, but that doesn't override the employer's duty to deal fairly with that employee. And if it meant that the people who were hesitant about the vaccine needed to go home and work from home, I'm sure the police could have done some cold case reviews at home, or the nurses could develop training modules for nursing students. I'm sure there's plenty that they could have done. So in that sense, it could have been a form of public service JobKeeper, where they remain at home, paid and doing other duties, or if no other duties, they can just stay home and be unpaid. But that problem is not theirs. That problem, all they're doing is choosing not to have medical treatment forced upon them, and we shouldn't make them the scapegoat for the pandemic. It's like a director's duty. It's a non-delegable duty that Mr McGowan, Roger Cook, the Health Department and the Commissioner for Police had, and they failed those employees terribly. You cannot delegate your responsibility for fair treatment of your employees to the Chief Health Officer and say, oh look, he made me do it. He made me sack my workers, valued frontline critical workers. That's not how it works. The responsibility for treating those people fairly rests with the employer. It can't be delegated. So what we need is a proper review, and I've highlighted some of the recommendations from the existing July 23 report that needs to be further looked at, including the federal government compensation scheme for vaccine injuries. But we also need to look at the fairer ways of dealing with people so we don't destroy people's lives when all they're doing is simply maintaining their right to bodily autonomy. The first step to honestly evaluating the true impacts of the government's COVID policy is to acknowledge that some West Australians did indeed suffer, and I commend the motion to the House.
Members, the question is the motion be agreed. The Honourable Wilson Tucker.
Thank you, President. I rise in support of this motion. I think the wording itself is fairly innocuous. I think it is common sense when you talk about the fact that there were adverse outcomes to the West Australian public during the pandemic. I think that statement alone is actually quite difficult to argue against. I would like to state from the outset that I do feel that the McGowan government did a good job for the most part in managing the pandemic. We have seen some recent examples where we know that the government isn't perfect, and the Aboriginal cultural heritage legislation is certainly an example of that. And I feel there are better outcomes that are achieved for the West Australian public when the government takes ownership over poor decision making and owns those decisions rather than trying to obfuscate or really tries to, cover up those decisions. It really takes ownership over them and potentially pivots into a new direction. And that's what we have seen with the Aboriginal Cultural Heritage Bill. Hopefully the new amendments and the new legislation is a good thing. And I think certainly when we talk about the previous iteration, it can't be any worse. So we know that the government isn't infallible, and that certainly applies to the handling of the COVID pandemic as well. Now, the recent COVID response, or the report into the government's response into COVID management, we know is a free kick. It's an own goal for the government. One of the adages I've learnt in this place is, one of them is it takes 3 years to learn what you're doing and then you're up for re-election. And the other one is you don't form a committee unless you know the outcome of that committee. And that is what we've seen with that COVID report. It is a free kick for the government. It really gives the government a glowing endorsement of its COVID management handling, which I have said I agree with a large part of it. But it does sidestep a lot of the more auxiliary decisions and actions that the government took during the pandemic. And I think that is a missed opportunity, and that's one where the government could learn by its actions and hopefully rectify those mistakes and put in a plan in place moving forward if heaven forbid, we encounter another pandemic in a situation of that complexity in the future. President, they were certainly unprecedented times and very difficult to navigate. And we talk about getting the entire West Australian public on board and trying to encompass everyone's thoughts and feelings and needs and wants and certainly desires in the community with your decisions around how to handle the pandemic. It is a very difficult and complex beast to certainly navigate. To share briefly my experience during the pandemic, I was living in the US at the time under President Trump. You can imagine some of the misinformation and certainly disinformation that was being floated around in the US at the time. There were a lot more liberties under Conservative government in the US in terms of your freedoms as an individual and also your ability to travel within the US. And for better or worse, I think I'm not certainly here endorsing the US government's response during the pandemic, but as an individual, I was allowed to travel more within the country of the United States. And certainly after spending about 8 months glued in front of a desktop, working remotely in my apartment and staring at a screen for 10 plus hours a day, I think I was going a little bit crazy. So I did take I did exercise that option and did travel a little bit around the US and tried to take some appropriate precautions. But at the time, I did get COVID. It was an unvaccinated dose of Delta, the Delta strain, and I wouldn't suggest that other members follow in those footsteps. I think it was probably the sickest I've been that I can remember. It's about 2 weeks of a very serious flu. I consider myself fairly fit and healthy, and I did have a lot of respiratory issues, so I can only imagine if you are elderly or you have some other health concerns, it will certainly exacerbate the situation. So it wasn't an easy time, certainly, but there was certainly some more freedoms in terms of what you can do at the time. Member, I'm not sure, but it was, look, I'm not condoning the US's response. It was, I think it's measured in the, you can have a stab at it. I can't remember the numbers, though it was huge and it was devastating to the community. Coming back to Australia, so the first port of call was the New South Wales border. I did the hotel quarantine for 2 weeks, which I'm sure members here have done the same. It is quite obviously a very isolating experience. I was during that isolation period. As part of that, you get PCR tested, I think, on a daily basis. And given that I had COVID antibodies at the time, I actually tested positive. And there weren't that many active cases of COVID in the community at the time. So it was kind of a big deal. I went from, I think it was in the Hyatt, so I think it's a 5-star hotel, and then very quickly being transferred to a sort of a health hospice. I think I went from sort of 5 stars down to probably 1 star. And the only interaction I had with people at the time was nurses coming in the morning and at night with basically hazmat suits to test me. There was a panel of doctors that needed to assess the case. They couldn't determine if it was a passive case and it was just the antibodies and I'd basically fought off the infection versus an active case of corona, which they obviously couldn't release me into the community at the time. So it was quite a stressful period to go through those hoops and hopefully get into WA before the border shut, which would mean doing the New South Wales quarantine, coming to WA, and then doing another quarantine. So it'd be basically 4 weeks isolated, which wouldn't be a very, I think 2 weeks in my opinion was enough. Certainly 4 weeks would have been very difficult. But coming back into WA, it was a sort of a bubble of freedom, you could say. I think for the most part, if you are certainly, use the example, if you're in your formative years, you're retired, and your worldview is basically everything you know and everyone you love is in WA, you're certainly happy with that situation, absolutely. You've got your caravan, your dog, your husband, your wife, your four-wheel drive, and the rest is history. You can stay in this sort of state of relative freedom for as long as necessary. But if you're someone with a sort of a different worldview, you like travelling, you have friends and family over in other jurisdictions, it certainly is a different experience. And these are sort of the competing interests that the government really needs to try and weigh up at the time. They were unprecedented situation, so certainly one that would be difficult to navigate, and I think one where there are going to be adverse outcomes regardless of the decision making of the government. So I think it is really a lose-lose situation for the government. And with the time remaining, I'm not going to get into the vaccine mandates or the border closures, other than to say I think the last border closure on January, the last January border closure I think was a mistake. We haven't seen the modelling yet, so I don't think the gold standard transparency was there. There was a claim that hundreds of lives have been saved. Potentially that was the case, but certainly it'd be nice to see that modelling. Mandates and border closures aside, there were some auxiliary decisions and actions that the government took that I would like to take this opportunity to talk about. Firstly, the G2G permits. The police really had an unprecedented level of discretion for granting and denying G2G applications, and there wasn't really any oversight, and there hasn't been really an inquiry into the system and some of the authorisation by members and by police officers, certainly by ministers, and members of parliament into who basically gets that tick and who gets denied at the border. Now, there was a case, I spoke about this during the pandemic. There was a case of Hannah John, who is a nurse who was coming to work in the Kalgoorlie Health Service. And there was an ABC article. In response to that article, I actually reached out and had a conversation, or a couple of conversations with Hannah. Her application had been denied multiple times, despite the fact that Hannah had provided all the necessary paperwork. She had a house lined up. Her partner was over in Kalgoorlie. She had a job offer coming into the health service, which was desperately needing workers, and it took Hannah over 4 weeks to basically, where she was stuck in a queue without really much information as to why her application hadn't progressed. And it took an ABC article to be published, and then a response by the minister, the health minister at the time, the Honourable Roger Cook, before Hannah's application was approved. And the only response by a health official into that incident and why Hannah's application had taken so long to be approved was a glitch within the G2G system had been fixed, which they were only made aware of yesterday, and that's the police force, and that Hannah's G2G application had now been approved. And so Hannah's case certainly wasn't an isolated one. This was certainly someone who was adversely affected by decisions by the government and by a system without any oversight or accountability baked into it. And Hannah's case certainly wasn't isolated. There were a number of people really fighting the complexity and the black box that was the G2G system. And there hasn't been any more information forthcoming around the number of people who were adversely affected by the G2G system, which is obviously an issue in its own right. The other point on G2G system is the promises by the health minister and the premier that the information collected, the health information, the private information that was collected as part of the G2G application would only be used for health-related purposes. And we know that that wasn't the case. The police accessed that information on several occasions during their inquiries, and then we had some legislation coming in after the fact to try and really close that loophole, which is a massive erosion of trust. And that information is still being stored in the State Records Act, and I believe it's determined that there's a 25-year timeline on that information being stored in the State Records Act, which is obviously longer than the information needs to be restored and used. So that is another issue as well. So there was certainly a misplaced trust element there, which certainly caused anxiety and eroded trust in public institutions, and certainly the Premier as well, who made that promise to the West Australian people at that time. And yet we're still waiting for the overarching data privacy legislation to ensure that these future actions within applications by the government or similar won't occur in the future. Given the time, President, I'll probably leave it there. I think I'll let other members speak on the mandates and the borders. I think that when we talk about the G2G application, certainly I think that is a clear case of people that have been adversely affected. And I think the really troubling part is here, we don't know how many people were adversely affected, but there's certainly a lot of anxiety in the community caused by the actions of the government. And as I said previously, I think the government, for the most part, did a good job in this space, but I think we've missed an opportunity with the COVID response to actually take a proper, deep and meaningful look at the actions of the government and really learn those lessons and try and not hopefully repeat the sins of the past. So I think it is a missed opportunity, President, and that is why I'm supporting this motion. I think the first part here is to really acknowledge that there were adverse actions and people adversely affected in the community. I think that is certainly a no-brainer. I think the first step is the acknowledgement, and then the second step is trying to rectify and learn from those mistakes.
Members, the question is the motion be agreed. The Minister for Emergency
Thanks,
Services.
President. I rise to make a contribution on the motion that is before us today. I was one of those members in this place at the time in early, I guess, 2020, when it seemed the world had gone crazy. I vividly remember at the time seeing pictures of bodies, people in hazmat suits, actually, in New York, burying bodies in mass graves. It was quite extraordinary. This was something like we'd never seen before, certainly in our lifetime, and hope that we never see it again. And for those of us who were in this place at the time, and indeed those of us in government, but also those of us in this place, we had some extraordinary decisions to make overnight and very, very quickly. And in fact, for those of us who were here, we recall sitting late and waiting for legislation to be drafted that we would deal with straight away to keep people alive. I think the last figure I saw, well, I've seen a couple of figures in relation to how many deaths have occurred since I guess February or March 2020 around the world, and they vary between 7 million deaths up to about, I think, $14.9 million is the figure that WHO uses, which relates to excess mortality, so it's people who died from COVID-19 directly or those who died from a complicating factor linked to COVID-19. They are extraordinary numbers. They are mind-blowing numbers. And the fact that, people, families around the world lost their loved ones, and in some cases lost the whole families to COVID-19 is quite extraordinary. We had some tough decisions to make in Western Australia, undeniably. And, and did we have a book on the shelf? Pandemic, how to deal with coronavirus, pandemic, no, we didn't. And we might have had pandemic plans, but to be honest, the last pandemic that the state had seen was, 100 years before. So nobody, nowhere around the world was ready for this. But of course, people shifted a gear straight away, and governments, state, territory, Commonwealth governments around the country really did work in lockstep. We took advice from those who know best. We took advice from the medical professionals, and decisions were made. And yes, rights and liberties were taken away from people. It's quite extraordinary. But they were done, those decisions were made in the best interests of keeping people alive. And I have to say, so we worked, as I said, in lockstep with the Commonwealth. There was only a couple of issues in terms of borders and Clive Palmer. Aside from that, we really did work blue, red, whatever colour of the party was around the country, people worked together to keep people alive at the time. Did everything go right? Well, there's certainly learnings that we've had. And that's why we instigated the review into WA's COVID-19 response, management and response. That was undertaken by the Honourable John Day, who was a former Liberal Member of Parliament in the other place, Emeritus Professor Margaret Sears AO, a distinguished public servant, but also a former Deputy Vice-Chancellor at the University of Western Australia, and Dr Michael Shaper, who had been the previous Deputy Chair of the Australian Competition and Consumer Commission. Did he? Wow. You must have been in your early years, because I would have thought he's close to your age. Yeah, right. So 3 eminent people, and they went about their work talking to various stakeholders, and in fact the report I have here talks about, there's an appendix in there, talks about the stakeholders they spoke to get feedback. And, they didn't look at things through rose-coloured glasses. There's things in their reports where they talk about, what they heard from people. And one thing I'll quote from is, in the report, they talk about vaccine mandates, and they talk about what the review heard. And so I'll quote, "Vaccine mandates, their efficacy and concerns regarding adverse reactions were significant themes raised throughout the review, with more than 70% of public submissions focused on these topics. The vaccine mandate received substantial criticism in some public submissions as an imposition on individual freedoms, while other submissions raised concerns about the safety of COVID-19 vaccines and the incidence of adverse events following immunisation. The review has noted the strength of the opinions voiced against vaccine mandates, both within Australia and abroad, while also noting the view of senior government officials that imposing a mandate was a tough decision, but nonetheless warranted in terms of prioritising the safety of Western Australians. The review heard from many stakeholder groups who praised the WA government for introducing the vaccine mandate, Medically vulnerable people, residents of aged care and their families, and the disability sector all voiced their support for the mandate and the role it played in protecting vulnerable cohorts. There was also strong support for the vaccine programme being free. And I recall at the time I had spent the first 4 years as the Minister for Disability as part of the McGowan government, and certainly in 2020 there was a heightened sense of anxiety amongst the disability community because we all saw people dying around the world from COVID-19. And people with disability need to access community services. Sometimes they need to have people in their homes delivering services. Sometimes they need to go to a not-for-profit service provider to access those services. And they, being immunocompromised, didn't want to access the services. They didn't want strangers in their home. They didn't want people they worked with a few times a week coming into their home to deliver services. Nor did they want to leave their home and risk catching COVID-19 from somebody at the time. It was an extraordinary time. And as I said, I hope we never have to face a time like it again. And difficult decisions were made at the time. But those decisions were made in the best interests. And of course, we didn't make them in isolation. As I said, we worked with the Commonwealth, we worked with other states and territories, but we also, for the main, followed decisions that were being made by other countries around the world. Now, we all didn't do it the same. We did it differently in Western Australia. And early on, we took a decision to put up a border. And I hear the Honourable Wilson Tucker was not happy with the fact that we had a border. But for those of us who were here at the time, our life, aside from the fact we couldn't fly overseas to Ireland or wherever to visit our family and friends, our lives were pretty normal in this state. Pretty normal. We didn't see the death and devastation that countries like America saw. We didn't see mass graves of people being buried on Hart Island. That did not happen here. And for the most part, I mean, while most of us probably have had COVID-19 since that time, we didn't see the death that other places did. And so, you know, so that is something that we can be proud of here. Now, as I said, so this review was undertaken. And it did examine what parts of the state's COVID-19 response worked well and what can be improved. Because, as I said, while there wasn't a blueprint or a book on the shelf about how to deal with COVID-19 up to then, we want to make sure that moving forward there is something, there is advice, there is a manual that others in the future can say, you know what, in 2020 to 2022, the world went crazy, mad, people died. But if this is going to happen again, then at least there's a body of evidence that suggests what should be, shouldn't be done in the future in terms of dealing with it. So as I said, we want to leave a guidebook or a blueprint for future governments about how to manage a pandemic and what tools are most effective. And of course, pandemics will all have their own characteristics. So just as this wasn't the same as the one from 100 years ago, I dare say it won't be the same in 100 years' time. Just like COVID had different variants that resulted in different responses and different public health and social or societal measures. So I am pleased to report that overall the review does reaffirm the approach that was taken in Western Australia to managing COVID-19. And it includes the quick action taken to mobilise emergency management structures, leveraging our geographical isolation through border controls to restrict COVID-19 case numbers, and also to maintain a strong and vibrant community. And I do recall post the kind of lockdowns and talking to colleagues interstate, and they saying, "Oh my God, you people in Western Australia, I feel so sorry for you." But actually, you know what? Our lives were virtually, for the most part, virtually unchanged. And yes, some people might have had reactions, and that's terrible. But for most of us, our lives were unchanged. We didn't have our kids at home for months at a time. They couldn't go to school, they couldn't hang out with their friends. In Western Australia, they could, albeit they couldn't go and see grandparents on the Gold Coast, which, again, was terrible and caused grief for families. But for the most part, our lives were unchanged here, unlike in places like Melbourne or wherever else around the world. We were, at that stage, the first state to complete an independent whole-of-government review into COVID-19 and how we managed it in this state. And I do hope that the report's findings benefit future generations to come. I think they will. So what did they find? Well, they found that we did perform exceptionally well during COVID-19 from a health but also from a social and an economic perspective. The independent review goes into the detail on each of these elements and does make a number of recommendations for future governments to continue the approach that was taken during the COVID-19 pandemic. The review also identifies several opportunities to enhance our ability to respond to future pandemics, and it made 35 recommendations which the state government has indicated it supports. Notably, the report recommends that current and future governments should continue to consider the trade-offs between health, economic and social outcomes when making future decisions on public health and social measures such as border restrictions. Now, I think this is an important recommendation because, as government, really can't make decisions, emergency decisions, through the prism of single issues. Or indeed individual circumstances. We have to take all factors on board, consider them, and then do what's right for the collective community. And that's a tough. You can sit there and smile and laugh. You weren't here. You weren't here in this place when we were making these decisions. In this place, you weren't here.
Order.
I certainly have empathy.
Order.
I have empathy. How dare you?
Order, members. Order. The Deputy Leader of the House.
I mean, honourable members can sit and smirk and smile or laugh in this place, but the fact is we made tough decisions to keep people alive in Western Australia. And I said 7 to 14, 15 million people around the world died. That did not happen in Western Australia. While we lost people, and every life is tragic, we didn't see the death and devastation this state that other places had. And that's as a result of people in this place on all sides of the chamber taking the issue seriously and voting sometimes late at night on laws that we thought could keep people alive, that we thought could keep people safe, that we thought could keep the economy going at the time. All those things were under consideration. There are always hard decisions we made in government or indeed in Parliament, but the decisions we made at that time, I don't think I had ever countenanced before, and I'm sure others hadn't countenanced either. The severity of the decisions that we were making, and certainly, in my time early as the Disability Minister, or indeed as my time later on in the pandemic as Emergency Services Minister, no decision was made lightly. And of course, we acknowledge that some of those decisions that were made did have an impact on people's lives and did impact some people negatively. But as the report showed out, governments have to balance these decisions, have to balance what's right for the community and have to protect the wider community. And that is, I think, one of the key defining roles of government, that is that it governs in the interests of all Western Australians. The review also suggests that all government agencies should schedule regular reviews of crisis management and business continuity plans. And this has to be a key part of our planning and hazard response for the future. It does recommend that, should we face another pandemic, that the government of the day should again establish an emergency management team when a state of emergency is called. And this is in addition to the emergency management structures that are already in place through legislation that we have in Western Australia. And again, this was an important feature of our management of the pandemic, because when the then Health Minister and Premier, together with the Chief Health Officer and Police Commissioner and other advisors, would meet daily, sometimes on multiple occasions in one day, this allowed clear, precise and indeed what I think is timely decision making to enable them to respond appropriately, and I think that's exactly what is needed in an emergency. And then, that gave us the ability to communicate and to action those decisions across government and through to the wider community. The review has also recommended that government review the pandemic elements of our emergency legislation, so we have a fit-for-purpose framework for future pandemics. And that is something that we're keen to do. And of course, another area that we made a decision on was, and we have been condemned on it, was to provide rapid antigen tests to the community. And so through the WA Free RAT program, we delivered, or we distributed, millions of rapid antigen tests directly to households, to schools, to community groups, and that had an impact. That had an impact on our community, and it had an impact on the numbers of lives lost, because by providing this, what I think was essential to households, it did have an impact, and it did give people some confidence about if they were feeling unwell, whether they had COVID or not, or indeed it probably it made us all be safer, and it allowed us, because they were free, it allowed us to make decisions and not have to think about whether I was going to buy a rat or I was going to buy food to eat at night time. So it has been a tough few years, undeniably. It's been a tough few years for everybody. This motion is a good motion to have in this place, because there's no problem with talking about COVID-19, and there's no problem with acknowledging that there wasn't a manual on a shelf, and that every decision was made, sometimes the first time that decision had been made in the history of the state. Decisions had to be made at the time, but every decision that was made was in the best interest of the state and of Western Australians. I think the review of Western Australia's COVID-19 management and response is a good one. I want to thank the Honourable John Day, Emeritus Professor Margaret Sears AO, and Dr Michael Shaper for the effort they put into it. Equally for, I guess, the breadth of their work and the fact that they spoke to people from all sides and people who had different views and sometimes diametrically opposed views. But they spoke to those people, they acknowledged those people, and they recognised those views in the report. So it is a good report. I think it will serve us well for future generations. Now, saying that, I do want to move an amendment to the motion that is before us. And so I move to amend the motion as follows: to insert after COVID-19 policies, and notes the findings of the review of Western Australia's COVID-19 management and response found that Western Australia's successful management of the pandemic led to excellent health, economic and social outcomes for the population as a whole.
Members, the Minister for Emergency Services has moved to amend the motion as follows: to insert after COVID-19 policies, and notes the findings of the review of Western Australia's COVID-19 management and response found that Western Australia's successful management of the pandemic led to excellent health, economic and social outcomes for the population as a whole. And the question is that the words to be inserted be inserted. The Honourable Ben Dawkins.
I'm very happy with the amendment proposed by my friend, President. I appreciate the hard work that the Honourable Stephen Dawson and others put in during the crisis, and I've never said there's anything inherently wrong with encouraging vaccines. I've never even spoken about borders or any of those things. Isolation or what do they call them, lockdowns? None of those things I've even spoken about. So it's absolutely the case that Honourable Stephen Dawson should be congratulating his government for those aspects of what occurred. There's no need to cross-examine what I'm saying. I'm just saying that I don't have any problem with the state congratulating itself for the things that it did correctly, and I'm happy to support this amendment to my motion. I note that it does say social outcomes as a whole, and you interpret it as you will, but I take that as an endorsement of my submissions today in regard to individuals. Everybody's an individual, and I was hoping for a little bit more empathy from the Honourable Stephen Dawson, and I say it's happened to my nephew, and so that becomes a personal circumstance, and it's only when it happens to you, and it happens to all of our constituents. So we should all have empathy for those individuals who have reported vaccine injuries and job losses. So the current report from July 23 had all the submissions that the Honourable Stephen Dawson has referred to about these individual harm caused to individuals. And I don't accept the premise that that this so-called good of the population overrides individual freedoms. There are other ways it could have been managed. I've talked about shutdown, I've talked about JobKeeper, not shutdown, sorry, stand down, JobKeeper. There are other ways in an employment context to deal with this rather than sacking people, good people, or asking them to have, or forcing them to have a vaccine, which then goes on to create an injury. That's liability. That's legal liability. There were other ways of managing it. So those, and I said, you can send people home, paid or unpaid, just like we did with JobKeeper. Nobody cares. Just let those people make their own choices about the medical treatment they receive. And that's what the Honourable Stephen Dawson has not acknowledged. And the report does not, from July 23, does not acknowledge it either, because all those submissions, they weren't published, they were just glossed over. They were just covered in one single paragraph. Oh yeah, there were, by the way, there were people whose lives were ruined, whose health was ruined, whose careers were ruined because of the draconian overreach by these vaccine mandates in certain professions. However, I'm happy to sing Kumbaya and actually have this other aspect amendment of the Honourable Stephen Dawson. In fact, Honourable Stephen Dawson, through the chair, one iteration of this motion actually had something along these lines. Anyway, it actually had, and let's do it even a better job next time. And I would like to see, and the more this has gone on since I've been taking carriage of this issue in terms of my electorate and constituents, it's that fundamental thing that the Honourable Stephen Dawson doesn't acknowledge, is that there were other options of dealing with these people, rather than overriding their individual right to choose their own medical treatment. There were other options. So I think...
Member, I'm reluctant to interrupt, but as you know, at the end of motions on notice, you'll get 5 minutes to reply to the debate generally. The question before the chair at the moment is whether the words moved by the minister should be inserted, and your contribution should be confined to the insertion of those words, not replying to every other argument.
Okay, I'll sit down. I'm ending now. All I'm saying is next time, and this should be part of that, is we get it better and we find employment laws that enable people to make their own choices, not be sacked.
Members, the question is the order members. There should be no interruption from the public gallery, and I just give a general warning to the public gallery that the debate should be heard in silence. The question is that the words to be inserted be inserted. The Leader of the Opposition.
Thank you, Deputy President. Deputy President, the Opposition is happy to support the amendment before the House. I was under some misapprehension that it was a replacement motion, but it's obviously I got that wrong. It's not. It's an addition to what currently exists. The motion before the House in itself was innocuous and inarguable. Really, it was the debate that followed it that is problematic, and I'll deal with that when we get to the substance of the debate. In my view, it didn't require an addition, but I've got no objection if the government wants to put that addition in, and the member moving the motion has accepted that as well. So I'm happy to get on to the substantive debate.
Members, the question is the words to be inserted. All those of that opinion say aye. To the contrary, no. I think the ayes have it. Members, the question is the motion as amended be agreed. The Honourable Dr Brian Walker.
Thank you, Deputy President. I listened with great interest to both parts of this debate here, and my contribution is going to be a little bit technical. Now, I wasn't in the House at the time all these difficult decisions were being taken. I was, in fact, practising at the sharp end of medicine, facing these life and death decisions at the time, because, bearing in mind, we had seen, as the Honourable Deputy Leader of the House had stated, we were seeing the body bags, and the death rate in China was 10%, allegedly, from the Alpha variant. And that is a terrible number of bodies to be burying. If this had gone on and indeed worsened, it would have been catastrophic. But there we have the actual problem, and that is the fear which arises. I mean, I was in Hong Kong when we had the first SARS epidemic, and there was a 2.5% death rate, and already we were having bodies piling up in the streets. metaphorically, because we couldn't bury them all in time. And that is not a good sign for the public. The Americans left in droves, there was fear and panic, people closed down, banks were shut. So panic is actually very easily obtained when you get these uncontrollable situations. Now, in that situation, and I will ascribe to every member of this House the good intent to serve the people of this great state of ours, and that every decision that was taken with the best of intentions. But as we've also discovered, decisions were made which, with hindsight, might have been better. As a seasoned medical practitioner, I've witnessed a spectrum of vaccine reactions. Look, your sore arm is one thing, mild discomfort, but I've also experienced severe life-threatening injuries, emergencies, anaphylactic shock, which is a lot of fun for a medical practitioner to deal with if you know what you're doing and you manage to save a life. It feels really, really good. But that does point out that vaccines are not without risk. My clinical experience ranges from administering the vaccines, but also treating or seeing cases where a vaccine has not been done or has failed. I've seen one case of tetanus and one case of diphtheria, which basically means that the childhood vaccinations work. I've treated lots of people who've survived polio. Now, that was at a time of an age when the vaccine wasn't as widespread as it was now. Vaccines have saved lives. But what about vaccine safety and efficacy? Now, so I'm going to draw your attention to that critical issue of vaccine safety and efficacy, particularly the COVID-19 vaccines. The gravity of this situation deserves our utmost scrutiny, just as we have recently rigorously reviewed the electoral amendment, Finance and Other Matters 2023 to eliminate potential corruption. We spent a lot of time considering that. But first of all, let's mention here one vaccine that I have personally administered but never taken, as the Japanese bee encephalitis vaccine. Now, catching Japanese bee encephalitis, 1/3 of the people die. 1/3 have irreversible brain damage and 1/3 recover completely. So you might expect a vaccine should be given to all people at risk. But at the time I was giving this, there was a 1 in 400 chance of a severe adverse reaction. Now, these adverse reactions could be severe allergic, nervous system, cardiovascular side effects, but death was certainly one of the potential side effects of giving the vaccine. So you give a vaccine to save a life, you've got a 1/3 chance of dying, and you've got a significant, not zero chance of dying as a result of the vaccine. That is a little bit of a problem. But this dichotomy is not unique to this vaccine. It's a recurring theme in immunisation, which is one reason why we need to have full medical disclosure and full consent from the parties involved, the doctor and the patient. Now, the thalidomide tragedy taught us the importance of long-term safety studies. It's a lesson seemingly overlooked in this rapid approval of the COVID-19 vaccines. We can all agree to this. Despite personal attempts to report adverse effects, that's my personal attempts, there's been a troubling reluctance to acknowledge these concerns. It's been actively discouraged to report these concerns to the agency. And this discrepancy raises serious questions about the integrity of our health regulatory system. And this is one area where we, as a parliament, ought to be looking. Are we really having security in our health regulatory systems? This is one area where we, in our pandemic, have to have a close look. Because it's important to have a thoroughly tried and tested vaccine, and that usually requires 10 or 15 years of post-research study and testing. Now, the thalidomide adverse effects were only really brought home after it has been brought into a general use, and then doctors reported this increase in fetal abnormalities. And that was accumulating abnormalities since the drug was introduced, because such abnormalities were certainly also known in very small numbers. But the rapid increase caused people to ask, I wonder why this happened. And so doctors were actively involved in recognising the problem, reporting it, and that eventually led to thalidomide being identified and taken out of service for pregnant women, although it's still in use today. But I had problems in reporting COVID-19 vaccine reactions. It was actually quite difficult, and it was made very clear to me I was an unpopular doctor. So if that is the case for me, and I'm sure for others as well, it's probably true to say that the actual relative risk of COVID vaccination in our city, in our country just now, is probably incorrect, because the levels of reporting adverse reactions is not 100%. And this, I think, is of immense concern. Am I alone in this? So we were told that COVID-19 vaccine would stop transmission of disease and prevent death. Now, neither of these statements is true. Neither of these statements is true. Now, I questioned the Chief Medical Officer on this, and he refused to give details to me in this very House, claiming his advice was cabinet in confidence. Trust the doctor, we're told. But the government's response was based on information which was not correct. And the vaccine mandates which we then got were predicated on the truth of these claims, which have been proved to be false. And so people have lost not just confidence in the system because of this manifest incorrect statement, but also people lost their livelihoods, their homes, because of their refusal to abide by what we now know were false assumptions. Now, let's go on, because it might be very hard to believe, but there's 3 senior editors of the British Medical Journal and indicated that the studies which extolled the COVID-19 vaccines as safe and effective cannot be trusted. Why? Because there is evidence of adverse event data having been hidden in similar situations. Now, in our just completed rigorous review of the electoral amendment, we discussed a major component, which was, of course, the shady donations to political entities, which might reduce the potential for corruption if we managed to control that. And we consider that of the highest importance, did we not? So let's compare that and contrast that with the Health Department just now. And the British Medical Journal has published that all the drug regulators, I'll say this quite slowly, all of the drug regulators, like the TGA, the FDA, and counterparts in other major Western countries and the EU, have received the majority of their funding from the industry they are meant to regulate. Now, a question was asked in the European Parliament and answered that the World Health Organization is now 80% funded by industry and NGOs, such as the Gates Foundation. Now, I understand our TGA appears 96% controlled by Big Pharma. Now, I could name names, but I will not do so here today. I'm just pointing out that we have a systemic problem within our system, not just for the pandemic, but for our general health in our great nation. We need to look very carefully at how we are being regulated. Now, as a person who works within the system, I can tell you, I do not trust them. And that's a sad state of affairs, because I should, because they're designed to help us, to keep us safe. Now, there's a revolving door also. There's a big revolving door for lucrative big pharma jobs, which is not an uncommon career move for the FDA commissioners and others who hold a health regulatory position. Now, this exposes our agencies. These are commanded to protect our public safety, but they manifest conflicts of interest and they downplay the adverse events risk. Now, I first came across this when I was looking at the Vioxx scandal and the Purdue Pharma scandal, both in the US, both which resulted in over 100,000 deaths from drugs erroneously approved by the FDA. Now, I'm going to go into some molecular biology, so I'll bore you for a little bit as to why the COVID-19 vaccines are unsafe. And that's because there's a pseudo-uridine-modified mRNA, called modified RNA, mRNA, is long-lasting and produces far more spike proteins over vastly longer time periods. 6 months, according to one study. That's much more than the few hours we were informed it would be by Pfizer, Moderna, and the TGA at the start of the vaccine rollout. 6 months as against a few hours. The lipid nanoparticle carrier envelope for the modified RNA carries the gene code to every organ in our bodies. It's millions of cells that can be transfected and produce spike proteins. The TGA knew this as early as January 2021, and that was only discovered in a Freedom of Information release of their report on the Pfizer vaccine. An FOI was required to identify the problem which they were hiding from us. Now, this is actually why we have adverse reactions which range from myocarditis to blood clots to neurological, autoimmune, skin cancer, and quite numerous other reactions. In the case of the AstraZeneca, there's an adenovirus shell encapsulated DNA code. the adenovector shell carries it through the bloodstream and into a wide variety of our body organs, hence a wide array of adverse reactions also reported, including the cerebral venous thromboses, which have killed quite a few people here. Now, a few months ago, I had in my clinic a gentleman who came with neuropathy, painful neuropathy, excruciating painful neuropathy. And despite every single symptom corresponding to the diagnosis of neuropathy, the neurologist refused to make that diagnosis. He could find no other cause, but he refused to ascribe this. Perfectly healthy gentleman, from one day to the other, developed sudden, excruciating neuropathic pain. But he refused to acknowledge neuropathy and refused to acknowledge it could be a potential COVID-19 side effect. Yes, I did try cannabinoids, and no, it didn't work. And yes, he is considering suicide because he cannot live with this terrible situation. Now, in the US, we had a teacher, Brianne Dressen, suffered the same neuropathies in the AstraZeneca phase 3 clinical trial. Her case was deliberately excluded from the paper in the New England Journal of Medicine that AstraZeneca said was safe and effective, and that's what the message was based on. She emailed the chief editor of the New England Journal of Medicine, who replied, telling her to go away, go tell the FDA. And he continued to allow the printing in his paper, his very esteemed paper, that stated that the AstraZeneca vaccine was safe. And he continued, and the health authorities continued to base their decision to call this a safe vaccine based on a paper which had excluded evidence of a serious side effect. Something similar happened to an Argentinian lawyer, Augusto Ru, with pericarditis in the Pfizer trial. Now, his adverse reaction was also not reported in the New England Journal of Medicine. And the TGA based their report on evidence which was excluded. So we're taking the data and we're excluding the unfavourable data, publishing that and saying it's safe. Now, both of their cases are described in the International Journal of Risk and Safety in Medicine, which, unlike the New England Journal of Medicine, does not receive industry advertising money. I think there may be a clue in that. In the meantime, Ms. Dressen, along with other unnamed scientists and clinicians, they set up a website, and a few months ago had compiled over 3,500 published studies of these gene-based vaccines' adverse reactions. So it's simply not science for health authorities around the world to still call these modified RNA and adenovector DNA vaccines as safe. It simply is not possible. Moreover, we've got a comprehensive literature review by an Australian and Swiss German authors, which highlights the synthetic virus-like effects of gene-based vaccines causing illnesses similar to severe COVID-19. And this raises concern about the long-term impact of these vaccines on public health. These are things we ought to be looking at seriously, because this is a scientific observation which so far has not yet hit the public consciousness. Now, myocarditis and pericarditis are now officially accepted as adverse events of mRNA vaccines. However, it's officially said that they are rare. Now, I myself must be one of those rare cases, because I have had myocarditis. And when I attended with my cardiologist, the staff confided in me that they had seen a surge in such cases, but they hadn't been able to report them. They dare not report these. Prospective studies are few, but they suggest that silent cases are common. There was a prospective study of 301 teenagers in Thailand receiving Pfizer and 777 hospital workers in Switzerland receiving Moderna booster. Both studies involved careful questioning and investigations for myo and pericarditis. They found the rate of myocarditis or pericarditis was 2.3% in Thai teenagers and 2.8% among Swiss hospital workers. Now, a majority of the cases were symptomatically mild or silent and would have been missed or sent home from hospital had they not had specialised scans. But these cases, my case too, possibly have long-term scarring of the heart muscle, and that is a plausible hypothesis for the apparent increase in sudden deaths. Now, the scarring, you see, is a foci for later cardiac arrhythmias, particularly when you're exercising or in the small hours of the dawn when the adrenaline surge happens. I don't know. It's something we ought to be looking at. So we have an unprecedented rate of excess deaths many of them sudden cardiac deaths, and now also cancers in heavily vaccinated populations that correlates both time-wise with lockdowns and the vaccines. Now, the people who are going to be looking at this most closely is not government and it's not doctors, it's actually the insurers, because they are the ones putting out the money to pay for the deaths. And I have been speaking with insurance companies who say, yes, we have to revise what we're doing because based on the pure finances, there's a problem in our society, one that we haven't fully recognised. Now, I'm not really going to address just now the mandated vaccines. I haven't got enough time to deal with that, but there is untold physical, mental and financial damage to our society. But what we have had here is a government which has had to deal with these issues at a time of great stress, great panic, and been given the information which has been faulty through no fault of the people in this chamber or other chambers around this world. But the information which has been fed to the specialists to feed into the government has not been of the appropriate standard. And you can see why there may well be concerns that the reasons it has not been fed into the appropriate bodies is because of financial gain on the part of those who are seeking to profit from a panic situation in society. I can think of no other reason why you would want to actually put out a vaccine and hide the potential effects, as indeed Pfizer has sought to do, depriving us, the doctors, of the ability to give solid advice to our patients. Which leads me on to the one question I do have, the problem I do have, is that we doctors have difficulty in reporting to the bodies about the adverse effects. And also, if I happen to have a paper which suggests that there's a problem with the vaccine and I mention it to my patient, I will, as many of my colleagues before me, be suspended from my work as a doctor because I have failed to give the government line. And this is a danger to the entire society. When doctors no longer are allowed to give the science, or one version of the science as it currently appears in peer-reviewed published press, because it might conflict with what the government is saying. And APRA, the medical body, is now removing doctors from public service because they have dared to stand up for truth in science. And this I would beg the government to look at most closely, because if there's one group of people, apart from nurses, who need to have the trust of the public, it is the doctors. And if we are not trusted to tell the truth, then the whole underpinning of the trust your doctor for the health of the society is going to be attacked. And I cannot allow this to happen. Yeah. The necessity for a comprehensive, unbiased and uncensored inquiry into the vaccine rollout is vital. We must uphold the principles of medical ethics, transparency and public safety. It's our duty as representatives of the people. Now, having said that, I will commend the Parliament here assembled for the work they have done and thank all the colleagues who were here at that difficult time. It was a very difficult time. And so I will give every support to the members here who've been through that very difficult time. But let us look and see behind that in more detail, how have we been misled by those other interests about which we at present know very little.
Members, the question is that the motion be agreed. The Leader of the Opposition.
Thank you, Deputy President. Deputy President, I was going to respond in order to some of the comments today, but I might start with my good friend and the second most qualified person to speak on vaccination science in the chamber, the Honourable Brian Walker, the Honourable Dr. Brian Walker, who I have to professionally disagree with some of his commentary. It is very easy to say that there is dispute amongst the medical profession, and therefore we take this judgment that a single dispute in the medical profession delivers a particular outcome. The medical profession and the scientific community has always worked on the majority view of the majority of scientists, and I think it is very dangerous for you to suggest that an individual doctor is perfect. Now, because I could make a joke about Dr. God complex, but we're trying to go straight to the point here. I think you raise a very difficult problem, though. And the first thing I would say to you is many people go to doctors and seek a second opinion. That doesn't mean that the first opinion is correct. Many doctors get it wrong. And so what we then use, for the most part, is the most widely agreed methods and theorems, as we do across the body of science in total. So I'm not going to buy into the conspiracy theories of pharmaceutical companies, etc. I actually think that was something of a disservice. But the simple reality is, if we take the science of this, as I've said in this chamber before, no vaccine is perfect. No vaccine offers you 100% protection from a particular disease. That includes all of the diseases that we have vaccines for, be they human or other or animal. No vaccine is 100% effective. No vaccine will deliver 100% protection from the spread of a disease. No vaccine. Anybody who has claimed that any different is wrong. No vaccine will prevent the spread. Any vaccine can be overwhelmed by a large enough infective dose. Any vaccine. So this argument that comes around that, you know, look, people who are vaccinated still caught COVID is a nonsense argument. The argument that the vaccine didn't stop the spread is a nonsense argument. The arguments put forward by the mover of the motion, the Honourable Ben Dawkins, I thought were somewhat specious. Now, I would have said that if the member had have moved his motion, a motion which is, in my view, inarguable and accurate, and probably should have then at that point sat down, because it was kind of downhill from there. The reality is that whilst the member seems to be highly focused on the rights of those people who suffered a vaccine injury or suffered or refused to be vaccinated, he missed the entire other side of the argument in his debate. And that was the rights of the people who caught COVID and the rights of the people who were protected by vaccination. Not 100% protected, because no vaccine is 100% effective. But those people who were able to walk down the street, particularly vulnerable people, people who were immunocompromised, who were able to walk down the street because of a vaccine program that was rolled out across Australia, not just this state, and I'm sure the state government wants to take credit for most of it, but it was a national response. It always has to be a national response. I will give the government credit for implementing the health advice it received. As I've said before, I don't deify the government for that. I don't think they were the champions. I think they implemented the health advice adequately, and I'm happy to give them kudos for that. But the reality is that the vast majority of the population of Western Australia was protected. Now, the problem, of course, with my good friend, the Honourable Dr. Brian Walker, in the medical profession is they're not very good at population health or demographic health, because they can't quite see past the person who walks in the door. So they're not ideal at looking at a wider population and saying what is the impact. So just a few numbers to throw out into the debate, Deputy President. Across the world, there were approximately, best estimate, and all of these are estimates, as all things are, 772 million cases of COVID-19 with 7 million deaths. So that's a death rate of 0.9%. In Australia, there was an estimated 11 million cases with 23,000 deaths at 0.2% death. So just on those broad numbers, you'd have to say Australia did significantly better than most of the rest of the world. And I'm reminded of a debate we had previously, the Honourable Dr. Brian Walker, where you were extolling the response in Germany, saying they weren't mandating. And I got up and said, well, in fact, they've just started mandating because they've had COVID rates of 40,000 a day. And their death rate has skyrocketed. So I'll just remind members of that particular debate. Now, in Western Australia, we recorded 1,241 deaths during the COVID period. Number of vaccines in Western Australia, I think 5-point-something million. Someone might have the exact number there, but there's about 2.5 or 2.6 million of us, and the majority had 2 or 3 vaccines. Some people didn't. Some people are unable to be vaccinated, and there was an opportunity for people who were immune suppressed to go to their doctor and seek an exemption. Not many doctors handed it out just quietly, because most doctors took the view that the impacts of COVID-19 would have been worse than the impacts of the vaccination. Now, the number of deaths attributed both by the World Health Organisation and the Commonwealth Department of Health to the vaccination program in Australia, not Western Australia, in Australia is 14. There are obviously a significantly higher number of adverse reactions. So in Australia, the TGA puts that at something like 140,000 adverse reactions, which are an enormous range, from, like every vaccine you take, every vaccine has a proportion of adverse reactions, from localised swelling, localised irritation, skin irritation, muscle pain, aches, all the way through. Some of them are more systemic, some of them go all the way through to fever, etc. Some people, unfortunately, get reasonably severe reactions to them. That's the group of people that should be identified by their GP and provided with an exemption, because that was available. Now, those exemptions needed to be small in number, otherwise you impacted upon the spread of the disease and you put vulnerable people at risk. But that was available to the community. So, just some basic numbers there, Deputy President, and it was certainly the case. So of the deaths, of the 14 deaths attributed in Australia, 11 of the 14 were attributed to AstraZeneca through issues around clotting, and interestingly, they seem to have a very genetic predisposition to that. 8 of those 11, were clotting in relation to AstraZeneca, so there's another 3 out there. The issue of cardiomyopathy is a real one. There is a very low incidence of cardiomyopathy that comes about through the mRNA vaccines. It is absolutely the case. Most of those cases are temporary, short-term and not severe, but it does exist. Now, I say what I've said. I've forgotten how many times I've said this, Deputy President, in this chamber. The risk of vaccination that we all take, that small, tiny level of threat, is our gift to the people who surround us. It is our gift to the population of Australia, particularly those vulnerable people. It is our gift. We take that on that small risk to protect the people for whom the risk is much greater. And we should do it knowingly. I agree with the Honourable Dr. Brian Walker. We should do it knowingly. We should be aware of the risks, and we should say, I accept this risk because that is the best thing for my family, for the people around me, particularly those who are immune suppressed and who are vulnerable. That is the small risk that we take. Now, there was an opportunity for people not to take that risk going forward, and you could refuse. There was a jobs mandate. I was interested in some of the comments of the Honourable Ben Dawkins. He did say at one particular point when he talked about the vaccine, which says which causes injury. It doesn't cause injury. It has the potential to cause injury. It causes injury in a number of cases. The Honourable Ben Dawkins also talked very much about the individual rights of autonomy. And I thought that was really interesting, because what became blatantly apparent in his contribution is that the individual rights of those members of the community who did not want to be vaccinated, obviously, in his argument, far outweigh the individual rights of the people who catch COVID or die from COVID or get seriously sick from COVID. And I think that's the issue. See, this is a simple case. It is if the individual rights of a person to not vaccinate themselves is important, so are the individual rights of everybody else. Otherwise, it is a very selfish argument. Otherwise, you put yourself and what you want well in front of everybody else in the community. Everybody else. And that is the problem with the argument of the Honourable Ben Dawkins as he's presented today. His motion, it actually makes sense. It is absolutely the case that people were negatively impacted by the COVID-19 vaccination program and by the restrictions. That is absolutely true. Businesses struggled. The government was dreadful at rolling out business support. It was an absolute failure at rolling out business support. That's the debate that we might have had. But the contribution of the Honourable Ben Dawkins was entirely about the arguments around the efficiency and the effectiveness of the vaccines. So it is of no benefit to the state or the parliament or the people for that debate to be paramount amongst all the other debates that occurred. Let's take a couple of looks back through history. I mean, when was forced vaccination first used that we're aware of? Was used funnily enough, in the American War of Independence, and it was this guy, George Washington, who went out and said, smallpox is decimating our soldiery. We're going to infect people with smallpox, and then those that survive it well, we're going to put in the army. So not only were you forcibly vaccinated, you actually, if you survived that well, you were drafted. and the English got to fire shots at you. You know, so well, I think we've passed blunderbusses at that point, but probably initially muskets before the self-loaders came in. Let's not have the gun debate today. So that was the first mass vaccination program, and you know, for all those that say America is the land of the free, that's where it first happened. It first happened in America. Well, let's have a look at disease outbreaks and pandemics. So the most obvious one to use, I mean, put aside you know, plagues and black deaths and things which are different. It's a flea on a rat that spreads a bacteria. When you start to look at a respiratory virus, the most obvious one to use is what we perhaps somewhat unfairly call the Spanish flu. Now, the Spanish flu killed, depending on the estimate that you use, somewhere between 30 and 50 million people worldwide. Now, bear in mind, we said before, that the COVID-19 outbreak pandemic caused, at this point, 7 million deaths. So, you know, five times the level of deaths in a population that was a fraction that it is today. I see we've just ticked over to 8 billion people, and we are now, at that point, I think we were closer to 1 billion. So the proportion of deaths was significantly higher, significantly higher. Interestingly, most countries, including Australia, put restrictions of travel in place and impinged upon people's personal freedoms. Why did they do that? Because great swathes of the population were dying. 30 to 50 million people worldwide. I think something like estimates of 15 to 20,000 in Australia, but it might be hard to tell. Again, at a time when the Australian population was relatively small. The difference in those numbers and the difference in control is about vaccination. Vaccination protected the vast majority of the community from the COVID pandemic. And in 1919 to 1922, when the Spanish flu was running rampant around the world, there was no vaccine. So there was no opportunity. Your only chance to attain immunity was to become infected. So the difference is the vaccine. But it is absolutely the case that governments then, state and federal, implemented restrictions and controls for the protection of the community. Governments recently implemented restrictions and controls for the protection of the community. Now, I'd happily have a debate with the Honourable Dr. Brian Walker about the effectiveness and efficiency of those, which ones I thought were reasonable and which ones probably weren't as successful as others. Like I say, I think there were business impacts. Some of the rollouts federally weren't bad. Some of the rollouts at a state level in terms of health were reasonable, but business support I think was average. That's the debate we could be having, and that's the debate that should have probably naturally fallen out of the motion before the House. Which ones worked and which ones didn't. But the concept that was proposed in the contribution of the Honourable Ben Dawkins was not that. It was to undermine the entire process of the implementation of restrictions, to cast doubt upon the effectiveness of the vaccination process, to cast doubt upon isolation in itself, and to trumpet this issue that he's referred to as the rights of the individual, but only for a very tiny section of the community. Now, perhaps it's the section of the community that he thinks will save his political career. I suspect it's going to require a lot more people than that group of people, the Honourable Ben Dawkins, to save you. I've got to say, the Liberal Party in the 21 election raised a few gentle doubts about the efficiency of the vaccine rollout, a few gentle doubts, never opposed to it. We had significant debates in this House. We were never opposed to the vaccine rollout. We were never opposed to the restrictions applied. We always accepted the health advice and the science of immunology. And I conducted numerous debates along those lines in this House. And we still got smashed at the 21 election, and we got smashed in part because the government, the people of Western Australia actually liked the actions of the government. I think unfairly, because I think the government took credit for a lot of the work of the Chief Health Officer, and like I say, they implemented the advice of the Chief Health Officer adequately. So I'd give them a pass mark, perhaps not a conceded pass, but in the old 1 to 7 university category, I'd give them a 4. So I think they're okay. But the people of Western Australia made very plain what they thought. The vast majority of them. To bring this debate back before the House, not the motion itself is fine. Like I say, you should have moved this motion and then sat down, because it was everything after you moved the motion that was the problem. If at that point we were simply debating that effect, that would have been fine. But what you did in your contribution is you picked this one small group, some of whom are still friends of mine who refused to get vaccinated, who are still very angry. Some of them who lost their jobs, who are still very angry. You're right, that small group is angry, and you can plug into them all you like. But that's not going to continue your political career, despite your best efforts. You're actually better off to put an application back in for membership of the Labor Party, in my view. You might stand a better chance. Point of order. Oh, okay.
Point of order, the Honourable Ben Dawkins.
The Honourable Steve Thomas is just banging on about political stuff in the background. We're talking about, it's not relevant, relevance.
Member, the first thing I'd say is raising a point of order is an opportunity to continue the debate, but there is no point of order on relevance. It is quite a wide-ranging motion, as you would appreciate. But I will continue to monitor the remarks of the Leader of the Opposition. The Leader of the Opposition.
Thank you, Deputy President. There's one for the end of your speech. But anyway, to sum up, and I didn't actually intend to speak this long, but some of the debate this morning has just been, some of it could not go unchallenged and uncommented upon by somebody who actually understands immunology and science, and I think that was important. So, what was put before the House initially was a very reasonable motion, which was then corrupted in this effort as it was. Supporting the motion, may I say, which we may well do, should not be interpreted in any way, shape or form as supporting the comments of the Honourable Ben Dawkins in his contribution after he moved the motion, because large swathes of that was just nonsense. But the motion itself, now whether it was amended by the government to, commend the report or not, probably is also immaterial. I think the chamber needs to move on from the debates that we had 2 or 3 years ago to the debates that we probably should have today. And I say this because, as I've said in this chamber before, at some point, another pandemic will come along. There will be another pandemic, because as you increase the population, simple science says you're going to increase exposure to viruses, viruses will jump species, and there will be another major pandemic. And perhaps the debate should be about how we handle the next one. What have we learnt from this one, and how can we do it better? Because I can tell you, as we go through next time, we'll be having probably the same old arguments all over again, and that'll be a really sensible debate to put before the House, because it will arrive. It is inevitable. That's the debate that we potentially should be having. The debate before the House today goes nowhere, achieves very little, and the honourable member might think that it assists his re-election campaign, but all I can say, if that's the case, good luck to you.
Members, the question is that the motion as amended be agreed. The Honourable Kate Doust.
Thank you, Deputy President. I rise to make some comments on this motion that we have before us, the amended motion that we have before us today. And the Honourable Steve Thomas, I find myself agreeing with you on a whole number of fronts. Yeah, I know. And look, the one thing I would say, you are correct. This motion is innocuous in its language, but you're right, the commentary behind it is not. And quite frankly, if it perhaps could have been much more targeted, if it was indeed going to talk about physical impacts of vaccinations or employment impacts, perhaps it could have been a lot clearer. You know, we saw COVID dance around Europe, and we saw the world change almost overnight. I was travelling with my husband in the beginning of January 2020, and by the time we arrived home, we went to all the COVID hotspots, as it turned out, but by the time we arrived home on the 1st of February, within a couple of weeks, the place was empty. The world had changed, and the Honourable Stephen Dawson has already referred to that visual of hospitals overflowing, the lack of facilities, the high rate of death, the burials on Ellis Island in New York City, visuals that we hadn't anticipated seeing. So the world had changed dramatically almost at the flick of a switch. We were dealing with a disease that kept morphing into something different. It was an absolute challenge for scientists and medical operators to keep up with those changes, to come up with the appropriate formula. I think it's a blessing that the researchers were able to come up with an appropriate vaccine in what indeed is a relatively short space of time. And I would say to the Honourable Brian Walker, your reference to thalidomide, it's a different world. It was a different purpose for that type of drug. It wasn't a widespread mandated drug, and I will say my mother used thalidomide when she had me, so I'm just very fortunate. But some of my friends were not. So it is a different world. So I think we should be grateful to those drug companies that were able, to the pharmaceuticals that were able to provide us with a range of vaccines in such a short space of time. In terms of how it was dealt with, we saw a range of other changes that led to how we managed this situation at a localised level. We saw democracy change. We saw the manner in which decisions were taken shift. So you saw the executive of government step up and take a much stronger role in decision making. You saw parliaments accede to that because they acknowledged the necessity to get quick decisions. And we saw that happen here in our own state. And at that point in time, we had 7 parties and an independent, and we saw those people working together. We saw those 7 parties come to the table and the independent, reach decisions, agree to change the way we did business in this House, agree to restrictions on debate, agree to who could speak. It was a different beast. We got through 15 specific COVID pieces of legislation over that period in 2020. In fact, and I stand to be corrected, I think we got 10 or 11 COVID-specific bills read in and dealt with over a period of 2 weeks. I remember we sat an additional period of time. I think we sat through a school holiday, which I think we've never done before. And the discipline of members throughout this chamber was incredible because they all knew they had to act in the best interest, the common good for everybody in this state to try and resolve the issues that had arisen as a result of COVID entering our state. Now, the report that's been handed down, I think, validates the decisions. And you're right, the Honourable Steve Thomas, not perfect. I don't think anyone anywhere in the world could say they ticked all the boxes to deal with COVID. But this report has identified areas for improvement in a whole range of ways, how to communicate, get rid of that, how to reduce that misinformation that was used by certain parties to scare people, to drive them away from the idea of vaccination in some places. And I think about how that was managed in some of our places in the northwest, in our Indigenous communities. Absolutely, absolutely. So, you know, the use of data sharing across departments. So the idea of identifying gaps in our legislation so that we don't have to do this quick fix Band-Aid approach that we had to do during that time when everything was changing. In fact, I feel for the leadership of our state during that period because almost on a daily basis, things would be different. There was no continuity, no certainty about what would happen the next day. And, you know, I think that was an extremely difficult period for them. And I say the Honourable Brian Walker, hindsight is indeed a wonderful thing. The decisions that were made in here were made in the best interest at that point in time, based on the information at that point in time, and honourable decisions made by this place. And I just want to deviate and thank all of the members who are still here for the work they put in and the collaboration that we saw. We probably won't see that again. But I also want to acknowledge the role that our staff in this building played, because it was a particularly tough time for them as well. And we actually had some staff here who were vulnerable with their health, and we had to make accommodation for them. And that then leads me into this question around the mandated issue of vaccinations, which, you know, I acknowledge that there are great difficulties for a number of people in our community, and I know that I reacted extremely badly to my first vaccination, knocked me out for a few days. I must say getting COVID was so much worse, and I'm happily vaccinated now 5 times. I very eagerly stick out an arm and say, you know, give me the needle that I need, because I don't want to get ill. So the issues around vaccinations are challenging, and you know, the idea of mandating would have been a significant decision for this government to take, not a light decision. And if you go to a lot of when you're dealing with these types of ethical decisions, because it is an ethical decision where you've got to say, how do you weigh up the interests of the individual that the Honourable Ben Dawkins has talked about? And I don't agree with him. I don't think that the right of the individual should supersede the common good for everybody. I think it should be the other way around. And in times of pandemic, you have to act in the best interest of everyone. The individual rights will be superseded, because you've got to make sure that you look after the most vulnerable people in our community. And I think who have their own set of rights indeed. And I think that's where government came to. And if you go back, I know that the World Health Organisation has talked about in the report in 2022 that, you know, you've got to take into account all of the alternatives when you're making decisions about whether you mandate vaccinations. Are those alternatives working? If they're not, then you have to make that hard decision in the best interests of all individuals in your community. And so what our government tried to do at that point was they put in place all of the other alternatives. They had that, unfortunately, I think vaccinations nationally were rolled out probably later than they could have been, and that's a whole other debate. Perhaps the take-up wasn't as rapid as they'd hoped, but for those frontline workers, it would have been essential to make sure that they were protected, and that they weren't going to be breaking out with COVID. So those decisions, I think, were significant. They were made in the best interests of people. If you go to some of the bioethicists that are around, and I had a look at an article by Julian Salavescu from Oxford, and he's in an article headed "Good Reasons to Vaccinate, Mandatory or Payment for Risk." He does like the idea of paying people. Maybe that's too challenging. But he says mandatory vaccination, including for COVID-19, can be ethically justified if the threat to public health is grave. And let's face it, colleagues, it was indeed grave. The confidence in safety and effectiveness is high. The expected utility of mandatory vaccination is greater than the alternatives, and the penalties or costs for non-compliant are proportionate. We then go to people like Margot Somerville, a bioethicist from Notre Dame University, and she also talks about that complexity when you're dealing with a grave situation where you've got to find that balance between the rights of the individual and the rights of the broader community. And she said that when you've got that situation where the risk of serious harm to health outweighs the individual's right to, as you've referred to, physical autonomy, she said that it's a situation in ethics called a world of competing sorrows. So it's a really, really tough decision to make. But if there's no other alternative, you have to err on the side that affords the greatest protection to those who are the most vulnerable in our community, and that's what the West Australian Government did at that point in time. And that's reflected in the report that was handed down recently. They've identified in their, I think, 35 recommendations, acknowledgement of what happened. They've identified opportunities for change, and and I note that the government has accepted all 35 of those recommendations. So there is a piece of work to be done. And the Honourable Steve Thomas is right. We're already seeing a range of literature where they're talking about the next pandemic. And we see recently a spike in COVID cases erupting around our country, perhaps a new variant. I don't know if it's been given a name yet, as all the others had been. We know that based on some stats that, and I'll just pull them up because I think it picks up on what you were saying earlier. These are not from the ABS, but they're from another organisation, which I'll find. But the West Australian vax rates as of the 22nd of August 22, in Western Australia, those that were dosed 3 times at that point was 81.2%, 2 doses 98.1%, 1 dose 99.6%. So quite frankly, that difficult decision to go down the pathway of mandatory vaccination worked. That is an outrageously high level of vaccination anywhere in the world. We had, if you check the comparison of deaths across Australia, Western Australia had the lowest rate of deaths. We came into, of course, once we opened the doors and our borders went down, I think that's when our numbers went up, but that's a natural thing to happen once we started circulating again. And I know that the only time I've had COVID was when my first time I left Western Australia in the July of that year, went to a family event, and it was one of those cluster occasions where we all came away with a gift we hadn't expected. So, but that was well and truly after the borders had been raised. So, you know, I think it's really good to have these discussions about how these things were managed, because it should be seen as a learning tool. And I think that the review that the government has received is possibly going to be one of many. You can break these things down into chunks and go away and do enormous research on every aspect. And I note that there was an article in the Sunday Times on the weekend talking about the impact of COVID physically on a number of people who live here in Perth. And I refer to Jeremy Nicholson, who heads up the Phenome Centre, the National Phenome Centre based in my electorate, an amazing scientist, researcher. And Jeremy, unfortunately, contracted COVID in the very early stages, in fact, I think 2019, 2020. And he talks about how the impact upon him physically is he now has diabetes and liver damage, things that he never had before. COVID presents differently in every person, and sometimes if you had an underlying issue, it will exacerbate it. You know, if you don't vaccinate, the idea that the challenge is, I think, for government was, do you just allow people to voluntarily vaccinate? Your numbers would be lower. You had a higher propensity for a significant death rate and a significant number of people who have other health issues possibly if they hadn't been vaccinated. Or do you compel people to be vaccinated and look after themselves and reduce both of those capacities? And I think the government made the right decision. In each of those situations, they made the right decision with their legislation. They made it in the best interests of all Western Australians, the collective good rather than the individual right. Member, I think those are issues we can deal with in a different situation. I agree with the Honourable Steve Thomas. You need to be very, very careful about trying to get your 2.8% to stay in this chamber. You need to target your motions. You actually need to do your homework. And I'll give you a big tip. If you're running something like this, stay in the chamber and actually listen to what people have to say. Be respectful of your colleagues in here. These are significant issues. Our constituents had to bear the brunt of these issues. They had to deal with the lockdown. They had to deal with changes to employment. They had to deal with changes to their lifestyle, the impact upon their own health, their family's health. This was indeed a dark period for all of us in Western Australia. I think, and my view is, that the government managed this in the best possible way they could during an extremely difficult period, in the best interest of the whole of the state, for the common good. And that's really how government should be applying or making decisions in situations as dire as the COVID pandemic was during 2020 through to 2022. Now, Deputy President, are you going to is there a reply, or should I keep going?
At 5 minutes, I'll interrupt. There's 6
Oh,
minutes
I've still got
remaining.
another minute. Oh, joy. I thought I was looking at the 4:23 and thought I had to finish. So, you know, there is a whole plethora of research that's being done. It's going to spark up a whole new industry about every particular element of COVID. And there will be law cases and points of law around how things are managed. There will be challenges. And every country would have managed it differently. I think that, and even within Australia, we see it was managed differently. I remember standing up at a conference in Italy last year where we were talking about the impact of COVID around a number of countries, and we had an ethicist from Stanford talk about Australia generally, and about how we had these outrageously high death rates, and he was an anti-vaxxer, and the impact upon us. So I actually took the opportunity to stand up at this conference and talk to him about how the government had taken these tough decisions that ultimately afforded full protection to the health and well-being of every citizen in Western Australia, that they acted in the best interest.
Order.
Not a popular
Order,
decision,
member.
but a successful one.
Order, member. I have to interrupt to give the Honourable Ben Dawkins right of reply.
Thank you, Chairman. I accept everything that the Honourable Kate Dowson and the Honourable Steve Thomas have said about this issue, insofar as, yes, it is about individual rights versus the collective good. And I think the Honourable Dr Sally Talbot, I think, was a philosopher, and I think she would tell me that it's about utilitarianism versus deontology, perhaps. So what we're talking about is, when does a blanket rule, and when is it justified, and when is harm to individuals justified by the greater good? And that's what the honourable members they were talking about this issue, and that's where this debate needs to be. But I differ from them in the sense that I don't think that the harm was justified by the greater good, and I'll tell you why. What I'm saying is the employment outcome for those people who were forced into it and were terminated because apparently they did not follow a lawful direction to get vaccinated. This is the police, this is the nurses, these issues are ongoing in the courts. What I'm saying is it shouldn't be, failing to have a vaccine should not be a failure to comply with a lawful order, or whatever those words are in employment law. Those people could have been relocated or redeployed at home on some form of JobKeeper-y type thing. Yes, they do. I spoke about Julie. I spoke about Julie from my electorate, who was terminated for not taking the vaccine. She had 23 years in the WA public health system, had a lot of expertise. Hang on, if you just let me finish. I want to just finish. Julie could have been redeployed writing up training manuals at home. And even if she wasn't, why terminate her, destroy that person's career and life for something when the honourable member's argument that it was protecting other people was also untrue? Because it didn't actually stop transmission. It may have stopped deaths, but we're talking about...
Order, members.
It has to be transmitted.
Order. The Honourable Ben Dawkins, when I call order, all members come to order. The Honourable Ben Dawkins has a very limited time in which to respond, and ask that he be heard in silence.
So,
Honourable Ben Dawkins.
The idea of the Honourable Kate Dowse that it was justified that to force people to get the vaccine, justified by the greater good, the flaw in that argument is that it didn't actually stop the transmission. And that's the only way that someone can protect someone else, is by not transmitting it, and that didn't actually happen. So that is no, I've looked at not stopping transmission. I've heard from other people, including Dr Brian Walker, about this, and including the medical evidence, including some of the reports. Pfizer didn't even, or AstraZeneca didn't even look at whether it affected transmission. So that was not a valid reason, so that those people weren't being protected by that. So the motion is fine as it is, because it does talk about some individuals being harmed, but it does talk about the overall outcomes were good. But that is the precise reason that we have these debates, because I'm advocating for the people that were harmed, that were lost their jobs, that were forced into getting it and had adverse events arising from the vaccine. So I think it's fine for me to highlight those things because those people in my electorate. I think the future of the Liberal Party is really dire when we don't understand individual freedoms and how they could have been done, but more how they could have been maintained. My friends at home in the Libertarian Party.
Order, members.
I think that my friends at home in the Libertarian Party that I know, but I'm not a member of, I think they should nominate for Parliament right now because the Liberals don't understand individual freedoms and bodily autonomy in the way that they should. But in any case, that we didn't even need to go there because people shouldn't have been sacked. That was my point. My point is employment law should be at a point where it is not, you don't get sacked for just wanting to maintain your bodily autonomy. That's my point, right? It's not there were alternatives to that. So the ends does not justify the means. There are alternatives to that.
Order, members. We're dealing with an amended motion, and that motion is that the Legislative Council acknowledges that some Western Australians were adversely affected by some state government COVID-19 policies and notes the findings of the review of Western Australia's COVID-19 management and response found that Western Australia's successful management of the pandemic led to excellent health, economic and social outcomes for the population as a whole. And the question is the motion as amended be agreed. All those of that opinion say aye.